Welcome to Health System CIO's interview with John Gaede, CIO at San Juan Regional Medical Center. I'm Anthony Guerra, founder and editor-in-chief. John, thanks for joining me.
Anthony, an absolute delight and pleasure to be with you today.
Well, that's nice. I appreciate that. We actually have been together before. And this makes me feel seasoned, I think is the good word, seasoned. So I was doing some research for our discussion today, and I saw that I had actually interviewed you in January 2011. So that is a bit of a ways back, long before anybody thought of a pandemic and lots of other stuff. So, pretty cool, right? We've been kicking around a while.
Yeah, absolutely. And you think about all that's happened, and just as you said, it's transpired between then,
Hmm.
quite remarkable for sure.
Yeah, very cool. And a couple of the things we talked about were back then were you were moving from Quadramed to Siemens, and keeping GE in the OR and possibly using Midas, which is another company that has changed owners and names, or a product that's changed owners and names. Anyway, uh, those are some interesting names and thoughts, right?
Absolutely. And you know what? It's remarkable to me when you look back then till now, we have many of the same challenges today. And some of those vendors have just changed names and some of them don't exist. So, but many of the same challenges, but it's neat to just see how the industry's grown since 2011.
Yeah, it's kind of interesting when you mention that. I mean, it seems to me that being passed around as a product or an application, it doesn't usually do much to enhance the product or the service that someone's getting from it. Some of these things again have been passed around to different owners. I don't know if it usually makes them better. And then you look at a company like Epic that hasn't had that happen. The way you're able to sort of keep focus and keep moving forward without those kind of, I almost think of them as a pit stops, and not in a positive way. So they're sort of, if you think of moving down the track, you're making progress. And anytime there's, a product changes hands, to me, that's going to be a huge pit stop, right? Just inevitably, you're going to lose momentum, you're going to lose focus, you're going to lose people. You may not be able to do the things that you'd plan to do with the product due to technology. We're going to integrate these things. Well, it never really seems to work out. Anyway, your thoughts?
Yeah, so I mean, there'd be a couple examples of that. One would be Midas, that they've gone through several owners since 2011. But you think about even Nuance, right? Nuance transitioned to Microsoft, and then
Hmm.
another very interesting one and relevant to our conversation today is the whole Oracle Health strategy now with Oracle acquiring Cerner, right? And
Yeah.
so these are examples of that. So now the Oracle Health will remains to be seen what happens from that, right? So I would argue that there's huge potential in that acquisition. I don't think it'll be just a stopping point. When you think about the challenges in healthcare, when it comes to the IT side and the people side. So it's people, process, and technology. And on the people side, hospitals coming out of the pandemic are faced with this challenge. We had all the traveler contract agency nursing, the costs associated with that. Hospitals still trying to come down out of that and reduce the agency dependency because of the expense tied to that. And so you got the people side of the IT. And so now you have a company for the first time that will have both potentially on the same database, both running Oracle, your ERP solution, so finance, supply chain, and HR, now sitting on the same database as your electronic medical record. So I think this will be a first for the industry. And so it's going to be interesting to watch what happens with Oracle Health. And the reason I'm even interested in this right now is because the position I'm at as the Chief Information Officer at San Juan Regional Medical Center, we're a Cerner shop. So the hospital went live on Cerner in 2019, just right before the pandemic kicked in. So of course, now this has my interest, and I'm watching this very, very
Hmm.
closely.
Well, I hate to bring it up, John, but I would be remiss if I didn't. But there's not a lot of good press going around right now about Cerner/Oracle. I mean, that's in the press right now that there's some issues over there. I assume you've seen some of that stuff, and I assume you're watching it very closely.
Yeah, and most recently, Yahoo Finance had an article about that, about Oracle Health losing market share.
Yeah.
I'm a big believer that leadership is everything in organizations, and vision. Without vision, people perish. And so when I look down, when I look at the future, and even we think about this in the context of our conversation from 2011, where I was at El Centro Regional, all the way till now, and the investments we've made in technology, and then understanding the value of those investments, and that pulls us kind of the cyber conversation. When you lose every system in your health system and you're trying to take care of patients, and that's happening right now with Ascension. They went offline May 8th and they're still offline. This unbelievably painful, and it hurts my heart to think about what they're going through, having been through something like that myself. But when I look towards the future, I look at the most important, the most valuable asset any health system has in this country are its people. The people make healthcare happen. And yet, on the other side of that coin, it's the most expensive part of providing healthcare are its people. So Oracle Health has an opportunity to bring in a system where they can come in because they have a blood bank, so they meet some of the FDA required requirements. So within that portfolio, so they have an opportunity. If they do this right, there's huge opportunity to actually have a strong competitor in the marketplace. And if I could, Anthony, if I could just make a comment there
Yeah.
on that. So I'm passionate. I'm honored to be here at San Juan, a standalone, not-for-profit hospital. It's a regional. You have to drive many miles in a lot of different directions to get any healthcare. So the community market, so 200 bed and below, we represent about 6,000 hospitals in the U.S. We represent about half that market. And we provide care to the people, to the farmers and ranchers that are providing our food. And so the role of the community hospital in the United States is absolutely critical. So we must have competition in the EHR space so that we can drive down costs, increase efficiency. So we need Oracle Health to survive so that we have a healthy competition. You got Meditech and Epic, Oracle Health. We need competition in the marketplace to make those companies better, but also to provide resources to the community market so that we can take care of our patients and provide the highest quality care. So we need Oracle Health to succeed in this. It's going to be interesting to watch what happens and see what happens. I'll just tell you, I'm an optimist because I see a day where Oracle Health will be able to walk into a hospital and say, here's your system. And that means the entire ERP, along with all your EHR, inpatient, outpatient systems, and you got supply chain tied to it, you got your people tied to it. So the potential is huge, and time will be the test to see how that all ends up panning out.
Yeah. Because if Oracle Health doesn't succeed or get their mojo back, or whatever you want to call it, momentum, and you know the size of the hospitals you're talking about, that community health community hospital, Epic may not necessarily want to play there. I know they've got some programs, Community Connect, but I don't think it's a place that their sweet spot, right? They're looking for the bigger organizations. So you might just, if Oracle Health doesn't get it going and Epic doesn't want to play there, you got Meditech, and that's not much competition.
Yeah, no, exactly. I'm hearing some good thing about Meditech Expanse. I try to keep my nose to the ground and interact with colleagues in the industry, and so I'm hearing that there's some advance happening there. I can tell you, as being both in an organization that used Epic primarily as its EHR, UC San Diego Health, and then Sky Lakes Medical Center as a Community Connect. So I've lived in both of those worlds. And I'll just tell you, the Community Connect is a good way to get Epic into smaller organizations. But I'll just tell you this, and I'm just going to say it. I'm a fan of Epic. However, it's just too expensive, even the Community Connect model. So this is just in my entire career. So over the last 27 years, when you look at our budgets, you're talking every community hospital I've been in is about a 1% to 3%, 0% to 3% margins. And if you have a 3% margin, you're having an incredible year. How many industries operate on 3% margins? So the community hospitals thinking about, the CEOs thinking about, I need to put in that new MRI. We need to make that investment in cancer treatment. And then I have these IT investments. And then when you wrap around that, the cybersecurity aspect, we now have a new slice of the pie that, whether you like it or not, investment has to be made there. Investment has to be made not only in technology, but also in people. So that bites into that 1 to 3% margin. So this brings us back to that, central point where we need competition in the marketplace. We need Oracle Health to succeed. It'll make Epic better. It'll make Oracle Health better. It'll make Meditech better, and it'll give options for that community hospital market.
Well, let's talk about some of the stuff you brought up, because it's really interesting, and it's what I'm hearing from some other quarters. And it's about this the financial crunch in healthcare. So I'm hearing this from other people. And if you talk about the dynamics, so there's work, like on the clinical side, right? There's workforce shortages. They're the most important people in the health system, and they're the most expensive. There's a shortage of them, so organizations are having to pay them more to keep them. So your payroll costs are going up. Everybody knows inflation's going up. That means all your supply costs are going up, right? There's areas in IT that you have to spend more money than you ever had before, such as around cybersecurity, right? It's almost not a choice, right? There may be some other compliance things that they're throwing at you where we have to do certain things. So there's some costs going up in IT, costs going up in inflation and supply chain, costs going up on workforce. I don't know too much about the reimbursement side, but you always hear it gets harder and harder to get paid, or you get paid less and less. So how acute is this situation? So two-part question. How acute is this situation holistically for hospitals and health systems? How severe is it? And then what could be the role of the CIO to help the health system? Obviously, you want to help them reduce expenses. You want to reduce your own expenses. You want to improve efficiency, but somehow you want to take either lower expenses or spend less, which seems real tough. So if you want to take those two.
Yeah. So first of all, you recognizing this as an acute challenge within healthcare, especially the community hospital market. So I affirm that. I agree. So Sky Lakes Medical Center, where I recently came from, I know they're facing challenges. We're finishing our budget cycle here at San Juan right now, and it's exactly the case. Balancing the capital needs and the operational needs and the expense side. So yes, absolutely a challenge. And then the reimbursement doesn't match the increased costs. So I think those are all true statements. And then you add one more factor, one more flavor to this. And that would be some of the programs that the federal government was putting out there that was really sustaining hospitals coming through the pandemic. Those programs are coming to an end or ended. And so there's this now, when you had millions of dollars that were flowing into even community hospital markets, and it's shut off, when that spigot's shut off, that really puts the community hospital in a tough situation. So how do we address it from a CIO perspective and from an IT perspective? So you mentioned, one of the words you mentioned was efficiency. I'm going to give you a couple of examples of that we're currently working on at San Juan. So we've hired Premier to come in and help us do an assessment, and we're really targeting length of stay. If we can increase our OR utilization and due to efficiencies, if we can impact our length of stay and decrease our length of stay, we can drive additional revenue into the organization. And I would argue that IT plays a critical role in that. So all of those systems, the handoff, the communication, the documentation, each of those pieces play critical roles in driving the efficiency. So again, we mentioned it earlier, Anthony, it's people, process, and technology. And so especially if you're looking at patient flow from admission to discharge, if you're trying to decrease your length of stay, all of those transition points involve communication, and those are systems that IT provides. All of those systems involve getting clear, concise, accurate information at the right time to the right person in that flow and process. And this is where our EHRs really come into play. And this is where our technology comes into play, because it's feeding each of those systems. So San Juan, we find ourselves in the place, and we went live on Cerner in 2019, and then the pandemic hits. So our hospital did not have an opportunity to go through that. Anytime you implement a new system, you got to go through the change. San Juan was a Meditech customer. You got to go through that change of process, and then the pandemic hit, and you take out 3 years of no optimization, no opportunity to really fine tune the system. So in order for us to effect this, and I see that as one of my tasks here at San Juan now, is to really drive the efficiency side of this, resulting also in quality, better patient outcomes through technology to tap into that. And so we're really poised where we know we have to do that next phase of optimization in order to get us to where we need to be to drive those efficiencies. So San Juan's been here for like 116 years, 1910, remarkable story of this hospital. And so I see my charge and my watch now here at San Juan is, how do we have the organization go another 110, another 116 years? What I can tell you is, if we don't have excellent IT, we're not going to get there. So that's really the task that I'm pushing Oracle Health on, is saying, look, we've got to partner in such a way that we can drive efficiencies, reduce our costs, and so that this community in this region of the country, in the Four Corners, which is absolutely beautiful. I've been here for 2 months. I've fallen in love with the people and the hospital and the community, and just all the activity that you can do here, outdoors activities. When you put all that together, we need good, efficient IT that affects patient safety, meets regulatory, and most importantly, helps drive a bottom line so that we can have the hospital for another 116 years.
And that's got to be a mindset of the CIO today, right? I mean, that has to be the mindset of what your core function is. Or is your core function different, or is that just a part of it? But do you need that mindset of, we talk to a lot of people, I am a business person. I am part of the operational leadership of this organization. Now, my angle is bringing technology to help solve business problems. So that's my angle. But nonetheless, I am here to help run this business, and this business needs to be more efficient, right? I mean, it's a mindset, right?
You're 100% correct. Yeah, and I'll just tell you, there's IT is an area where, if you make the right investments, in people, and it's in the people that run the technology. Our technology is getting better and better. You're bringing technologies like AI and other things, but there's always people that have to be behind it. So that efficiency is driven, not reducing waste. We learn in our lean principles, those kind of things, but it's driven through investment. I would argue it's driven through wise investment, getting the right systems in place. And then I would say it's not just having a system in place, but it's having systems in place. And I'm guessing if we went back to our archives, 2011, I might have talked about this, but having partnerships with vendors where we're not in a vendor-client relationship, where we're in the true partnership in the truest sense of the word, where we say, here's our mission, here's our vision. Will you join us in this mission and vision and driving care for our community? And together, you're going to have to give some, we're going to give some, but we're going to partner together so that the outcome is we drive the efficiencies that we need so that we do have a bottom line. And so absolutely having that business mindset, we can't do it without the CIO engaged directly in that and participating in that process.
And this is usually where I always think about the lead versus follow dynamic of IT leadership. And what I would say about that is, maybe the old school IT director was sort of an order taker. When the business asked for something related to technology, he said, okay, I'll provide that. But it certainly has to transition to more of a deep, deep understanding of the operations, including the clinical operations, So you cannot wait for them to ask, but you can suggest,
Yeah.
right? You can say, I know intimately about this particular workflow, and I know there's technology out there that can streamline this for you. Let's have a discussion about that. Again, as opposed to waiting for someone to ask, sitting there saying, well, they didn't ask for it, so I'm going to do other things.
Yeah, you're exactly right. I'll give you an example of that here at San Juan. So the communication platform, we don't have a unified communication platform across the organization. And what I learned through our ordeal at Sky Lakes around the ransomware attack, where we were offline from October 26th to November 18th, that 23-day period had 100% of our systems offline. I learned that clinicians will do whatever it takes to take care of patients, but if you can provide them communications, that's the number one way that they can not compromise in the quality of care, taking care of patients. So I get here recognizing how important communication platforms are within the organization and the EHR. And we have multiple systems. And so that's where that consolidation of systems and having the CIO that can come in and strategically look at it, but also come in and just say, hey, there are systems out there that we can comprehensively do. We can consolidate the platforms. We can save some money. We can save on the support side and the number of people it takes to run all these systems. And we can synthesize and bring them together on a platform that are going to really assist you and come alongside you in that core communication element, just as an example of that. But you're exactly right. Another example of that recently here, we're in the process of rolling out a telesitter program with Avasure. And the organization didn't have a CIO at the time, and the clinicians went through a process to purchase the technology. And I happened to use that technology at Sky Lakes. Works very, very well, where you have robots. So you're saving on not having to have staff sitting in every single room where you need observation, eyes on a patient. You can now have a robot in there, so you can now have one person to multiple patients to have that conversation. Very good technology. That's a wise use of technology. But the project was underway. I get here and I'm sitting in one of the meetings and I look and I know that they have a fully redundant system. So we went and renegotiated the contract, and they stepped up to the plate. They helped us keep it within the same costs. So it was a great partnership. But we went back and put in an enterprise solution so that we're not going to have downtime when we're patching, doing Windows, back to cybersecurity, when we're doing our cybersecurity patching every month, and then having to staff up in those periods so that we can patch the systems. So we went to an enterprise solution. So this is an example that came in and suggested, hey, we can make this better for you in providing a technology that we can build out an enterprise system so we don't have downtime. And we don't have to, we can have the system over here patching, we're running on this system, right? And then move back to the other system. But that's the leadership where the CIO can come in and provide leadership to their wonderful colleagues and friends on as the chief nursing officer and nursing in other areas of the hospital like that. But that's a great example to that point.
Let's talk a little bit more about cyber. Um, when I read about the Ascension stuff, and I've thought this before, that you've been through this, so you can add a lot of color and thoughts about this. You mentioned a communication system and how that's important in an outage, or, important at all times, but in an outage, I wonder, so one question is, would that even be available depending on the scenario of the outage that you're thinking about? It perhaps it might or might not be. But when I read about the Ascension stuff, it just reinforces my feeling that it's almost impossible to plan enough for this that clinical workflow can sort of continue to function, not seamlessly, but even smoothly. It's like the systems are such a part of of their DNA, of the fabric of their work, that going to paper is just rough. It's really rough. So what are your thoughts?
So you're getting to the heart of the issue. If I would have one message to anybody listening to this podcast, is I'd been in healthcare, doing healthcare IT 25 years, and And we had our downtime processes, and the downtime processes worked great for the first 48 hours. 72 hours start breaking down. After that, they completely break down. So the first point, no, you wouldn't have a communication system up. So I've gone to Vocera and said, you guys need to figure out how to have an immutable system. I realize there's no one immutable but God, but we need a communication system that's immutable. But just what you discovered, and I'm going to take a quote, I'm going to steal this from Ron Woida, the chief nursing officer at Sky Lakes Medical Center. He said, John, what I learned through our ransomware attack was we work downtime out of the process. We work downtime out of the process. Here's what we mean. You can remember, so even back in 2011, we had a number of paper medical records, right? We still were in that, we had a lot of paper as well as electronic systems, and now we don't. You can walk into HIM now and medical records, and we don't have a room filled with files any longer. It's all electronic. So when every system in your hospital, the investments we've been making for the last 18 to 20 some years, which have shown to be just this ransomware attack and being offline, and Ascension is going to learn this, those investments are incredible. They've helped with efficiency. They've helped with drive patient safety. They've helped with the people aspect. So in the paper world, when that order gets placed in the ED, that order needs to be faxed up to the lab, or somebody has to take that order up to the lab. In this new world, that's all done electronically. Well, when you go offline, all of a sudden you're moving paper through the entire organization. And so our backup strategy for that was the fax. What we discovered is that faxing totally broke down. So I'll give you an example. We had 2 fax machines in the lab. Literally one of them overworked and started smoking. We had to shut it off. But when you start getting orders, stat orders coming from ICU, from med surg, from the ED, from your clinics, you get all these orders. You got diagnostic imaging, pharmacy, laboratory. All of a sudden, that stat order down in the ED, you could put it on the fax machine. It could be 30 or 40 minutes before that fax kicks out on the other end because of the sheer volume and the time it takes for a fax to run. So we ended up having to have any staff that weren't doing clinical roles had to become runners. So think of it, you're down in the emergency department, you draw that rainbow set of tubes, you have a tube system. Oh, that's offline, right? Johnson Controls is now offline, your tube system's offline. Who's going to get those tubes from the emergency department back up to the laboratory? Guess what? You got to have somebody do that, a human do that. We got to the point where we had to have people just running a stat order, had to have a human take it up to the laboratory to get that done, or that stat order over to diagnostic imaging. So we worked downtime out of our process. In our case at Sky Lakes, we were 100% offline for every system. So all of the ERP, all of the EHR, we weren't sending bills out. We weren't receiving invoices, no email, no communication systems. And that was brutal. It was rough. And what it caused me to do is really reflect on, what if we ended up surviving on our cell phones, right? So then you realize you don't know people's numbers. You can't call people and you can't call vendors to notify them because you don't have them in your contacts. And then you find out that your cell service doesn't work in the center of the hospital. So in order to even text and those kind of things, you have to go towards the periphery of the hospital to have that communication. But I began to reflect on, what if there's some kind of natural disaster where we wouldn't have had cell service at all? So if I could leave one nugget for anyone listening to this, our conversation today, it would be this: think about your long-term outage, and because someone in this country is going to get hurt in this process. All you have to do is, I've recently watched 2 interviews with news agencies interviewing nurses that are at some of these Ascension hospitals, and this traveler said, you know what? I quit. I'm walking out because my license is going to be on the line when you get down to these paper systems. So I can't say enough about developing sitting down and at least having the conversation around your long-term outage strategy. Just as an example, do you have enough scripts? Do you have enough pharmacy scripts, paper scripts? We didn't at Sky Lakes. We went to we've moved to these inventory systems that are just-in-time inventory. All of those processes now fall apart and they break down. I'll give you one that you may not think about. So when we were prioritizing bringing our clinical applications back online in our outage, cancer doesn't wait. What about radiation oncology that's giving in a day after day after day, a series? So we knew that system's got to come back online towards the top. So we were prioritizing all of our clinical systems, and then the director of facilities comes to me and goes, John, it's starting to snow outside. We can't get patients into the emergency department because we can't heat our sidewalks because Johnson Controls isn't online. So it's examples like that, right, that show the value of the investments that we've made in IT and the need for health systems to talk through and think about losing all your systems for an extended period of time. You can go offline, we're great, 24, 48 hours. Chris Van Gorder and their outage at Scripps in San Diego, they were hit like a year after us. And there's an article in the San Diego Tribune where he just said, we discovered that our downtime processes broke down. So when you add time to the outage, it's having even enough paper. We went and bought out all the paper at Staples and Walmart in our community because we didn't have enough paper just for managing all the paper processes. So those are the kind of things that our industry needs to talk about. And I appreciate you having this conversation with me. I had the privilege of sharing the story at HIMSS. I think this needs to be talked about. And I don't think our industry talks about this enough, for fear of legal implications, all these other, but it's not going away. It's flat out, there will be all kinds of things. And I hope Ascension chooses to be transparent when they come out of the backside of this and to talk about it, because anybody who hasn't been through something like this, these are the kind of conversations we need to be having so that we can strengthen and make sure we take care of our patients, even in times like this.
Yeah, great point. And from what I've heard, it's not the IT executives that are reluctant to talk, because maybe when this started, there might have been a stigma around, oh, you got breached, you failed. I think that is gone. I think if anything, we look at people who've gotten breached and say, share and help us learn, right?
Yes.
So you're not, it's no longer a negative thing in a sense. The assumption is that good work was done and that there was no negligence and that it could happen to anybody. And so it's not the IT executives, I think, that are afraid to talk. It's the lawyers. And I think everybody knows that's the lawyers that tell them not to talk, right? They don't want to
Yes.
create jeopardy. I want to ask you one more question, and I'm going to let you go because we're
Okay.
about out of time. It has to do with this um, practices or planning breaking down after significant or excessive amounts of time. And you could put some numbers on that if you want. You're busy. Everyone's busy. Everyone's got a lot of stuff to do today to keep the organization running. Business continuity planning is important. Insurance is important. But we can't plan for scenarios that are extremely unlikely because they would take a tremendous amount of resources. If you say, I want to be ready for a 60-day outage, that's going to take a tremendous amount of resources and may never happen. Those resources maybe it's better to plan for a 15-day outage and take the rest of those time and resources and money and focus them elsewhere. So you got to figure out, what am I planning for? And then what do I say? Hey, what are you gonna do? You can't plan. You talk about cellular outage. The phones don't work. You can't plan for a nuclear war, because at that point we're not really worried about operating the hospital. We got bigger fish to fry, like staying
Right.
alive. You see my point. What are your thoughts?
Yes. Yeah. So I think it's a good point. And I'll just say this: it's hard work and it's more work than you think. And yes, it's never going to happen. I'll give you a perfect example of this. Christy Wiles, who's the over nursing at Sky Lake's wonderful colleague and nurse leader, she said, John, if you had to give me a choice, I wouldn't want the choice. But if you did give me a choice between a novel virus and a cybersecurity outage over an extended period of time, she goes, I'll take the novel virus. We're scientists, we can figure it out. But when you remove all the tools from me doing my job, all the patient safety checks, all that, the stress and strain it puts on nurses is just incomprehensible. So here's what we did at Sky Lakes. I actually went to my boss and said, Rich, I need to I asked for another FTE to do this process,
Mm-hmm.
to go build these extended downtime playbooks within the organization. Well, the organization couldn't do that. We couldn't go hire another FTE to do that. So what we did is I got together with my team and said, look, we just went through this cyber attack. We saw the impact, the potential patient care. Let's take some of our time, a portion of our time, and let's go help operations build playbooks and identify, so that if something like this happens, they can open it up, they can look at a one pager and say, here's the things I need to think about. These were the things that we learned in this outage. So it took us 2 years, to your point, it took us 2 years of meeting one-on-one with all the departments, and we began to build out that playbook and have that, what are those key learnings? And before that organizational memory was lost, we built those things out. And that's most effectively seen in Christy. She had a drawer that she kept in her office and said, here's all the things I need to put together to prepare for something like this. And she put it in the drawer, and that drawer was never opened. It's just a reality of life. But IT, we took some of our resources and said, we're gonna dedicate, if it takes us 2 years or 5 years, we're gonna start putting together these playbooks so that if something like this ever happens again, Christy can open it and go, okay, I need this, this, and this. I need a file system here. I need to do this. I need to rearrange my staffing like this. And so we did it. It's hard work. It's not easy, but I'll just tell you, if organizations will at least sit down and have a conversation saying, what if we were out for 5 days or 10 days? I think if you get anything beyond that 72-hour window, that process is going to be sustained, whether it's 60 days or 15 days, whatever it is.
Yeah, great stuff, and it makes perfect sense about the choice she made to me about picking the novel virus. The way I think about it, well, I don't know if this is a good analogy or not, but I think about it as if you're a carpenter and you have your tools and you're going to maybe do some framing and frame out a house. You have your tools, and then somebody tells you, go frame out a house, but give me all your tools and figure out another way to do it. You're going to say, what do you, I can't. Right. So maybe not a perfect analogy, but that's kind of how I think about it. So, John, tremendous conversation. I could talk to you for another hour, but I won't, because I'm sure you have things to do. But thank you so much for your time today. I really enjoyed it.
Anthony, thank you. A true pleasure. Blessings to you.